friends, and welcome back to the PT Roundtable. I'm your host, Dan Burrow, and I'm here with Ryan, Carter, and Jesse to answer your most frequently asked questions about physical therapy. Today's video is all about patellofemoral pain.
Patellofemoral pain is really, it's exactly what the name says, in that there are two parts of what that junction inside of your knee is consisting of. And so you've got your patella or your kneecap that sits right over the top of our long leg bone, which is the femur, and so hence patellofemoral. So really this is more of a vague diagnosis, if you will, that you have pain near or around your kneecap.
Without further ado, let's get to our viewers' questions. This question comes from Hunting in Hancock, and he writes, I noticed that my knee started to hurt when I was deer hunting a couple of weeks ago, but I didn't fall or have any injury to my knee. It has been sore for a few weeks and doesn't seem to be getting any better or worse. I am still hunting a few days a week. Do I need to see a doctor or will I need surgery?
Fair questions. Likely what's going on is with the increased walking through the woods, the increased high stepping over logs, walking through potholes, getting to the stand, climbing the ladder, but then also sitting for an extended period of time, patellofemoral pain syndrome has kind of developed. Okay, you use a lot of those quad muscles, those hip flexors, things like that, and they get really active, and then when you sit down, they want to shorten up. And because of that, a lot of this pressure and tension is going through the knee, causing a lot of pain that they've been having. Do they need to see their doctor? It's not a bad idea at this point. Would you guys agree?
Probably, yeah.
Okay, the next question comes from Dancing on Eggshells. I'm a dancer and my kneecap hurts after I finish a dancing session. I've noticed pain especially after routines that have a lot of jumping. What can I do to get rid of this pain without having to stop dancing?
Likely when they're jumping and doing a lot of landing, they're using their knee too much for the shock absorption and not using their hip, their ankle, everything else equally.
Mm-hmm. And that being said, too, if we think about dancing, you know, a lot of times landing in these certain positions that bias more hip absorption of that shock versus knee is super hard. And so unequivocally in my brain, getting stronger will help out in a lot of different ways. And sometimes that is the root of all of it, but other times it is, like what Ryan was saying and what we were talking about earlier, how you're moving and how you're landing and how you're doing these things will be a big factor as well. But that's something that we take into consideration when we're working with these sorts of athletes is, okay, you're a dancer, what kind of dancer are you, and what are the demands of the type of dance that you're participating in?
All right, now we're on to a segment called Don't Do That, where our panelists are going to compete to tell us what the person in this situation did wrong. This person writes in and says, why does my knee hurt when I play video games? And they sent us a picture. So here's the picture. Why does my knee hurt? Jesse, you can have it, even though we disabled your buzzer.
So the way that you're sitting your knee, with your knee in kind of hyperflexion there. Really, our body does not want to be stationary for any long period of time, but having that much strain through the joint for a long time and having compressive force through the floor into that patella, into that kneecap, could eventually end up causing some pain.